Welcome.
Welcome home, baby.
I like this kind of party.
Putting the fun in dysfunctional. Each and every weekday morning, the Pat and Aaron Show.
Is it a little too early for being that loud?
Good morning, Tampa Bay. And here we go. Now your hosts, Pat Donovan and Aaron Jacobson.
Hour number 3 of the Pat and Aaron Show. Thanks again to USF head coach Alex Golish for joining us for an extra long conversation. We stretched things out a little bit. Normally about 7:45, we have our injury report with our friends from the Florida Orthopaedic Institute. But instead, we had to move that into the 8 o'clock hour and move that to right now. And, of course, the Pat and Aaron Show injury report is presented by Florida Orthopaedic Institute in partnership with Tampa General Hospital. And joining us right now for the first time, always excited to get a new doctor on, Dr. Eddy Echols. Doctor, good morning. Thanks for being with us.
Good morning.
So Lamar Jackson, of course, suffered a knee injury this week. He's being considered week to week for the Baltimore Ravens. He exited, of course, in the second quarter with a potential PCL strain and or bone bruise, which is confusing to me that a bruise and a ligament could be confused, or, it could potentially be one or the other. First of all, talk about what the PCL is, because we don't hear about that ligament as often as, say, the ACL. And how is it that you could confuse potentially a ligament injury with a bone injury? How is that something that's not, I guess, a little more easier to detect?
Okay, all right, so you're right. We hear about the ACL more frequently than we do the PCL. And the PCL is actually a lot harder to deal with when it is injured. Now, the way that you routinely injure your PCL is if you have an injury, a blow to the anterior aspect of your knee. So in that regard, a bone bruise is just like you get a contusion. Say if you hit your arm really hard and it gets sore, it's a contusion. Well, bone bruise is kind of the same thing. You basically see fluid within the bone on an MRI. And so when we look at an MRI and we're evaluating ligaments, then we're looking for what we call signal within those ligaments. And so in that regard, you could actually have signal in the adjacent bone as well as that ligament. And just to kind of explain what the PCL is, the ACL and the PCL are those ligaments in the knee that keep your shin bone from moving forward or backward in relation to your thigh bone. And, there you have it. So, yes, he sustained that injury. And, the good news is that it doesn't appear to be a complete tear from what they're saying. So, there is, that's the positive aspect of it.
Dr. Echols, one of the reasons we love you all so much, we love having the doctors on from the Florida Orthopaedic Institute and Tampa General Hospital, is you all have personalities and you like sports as well. I'm seeing on the text line, somebody must know you. They're toying with you. We got a text. Go Army, beat Navy. Are you a Navy grad?
Yes, I am an Annapolis grad, and but I'm sure Navy will prevail.
Well, thank you for everything you've done, and certainly going to Navy, extremely impressive. Pat and I, this is the first year we're not going to be in Philadelphia for the Army-Navy game. Our good friends Zach Blobner and Jay Retcher, they're there, but I'll tell you, it is so much fun every single year, Dr. Echols.
Yes, it is.
All right, so I want to get back into football here. Kenneth Walker, we all know he's having a really good year as running back for the Seattle Seahawks. Saw he had an ankle strain, and Coach Pete Carroll had to come out and say the MRI revealed it was a strain and not a sprain. So what's the difference between a strain and a sprain?
Okay, so in essence, they are along the same category. It's just difference in severity. So when we look at a sprain, once again, when we refer back to quote-unquote signal on the MRI, we're basically looking at, fluid within that ligament. Now, when we talk about strains, we're really kind of talking about partial tearing or stretching of the ligament. And here you hear mild, moderate, severe. So technically, if you have a sprain, then there's just stretching or tearing of the structure.
Now, Jimmy Garoppolo, it sounds like he could be potentially okay for the playoffs. Of course, he went out this past week, and they thought originally it could be a Liz Frank injury, but they're saying he did not suffer a Liz Frank injury to his broken foot, and he's not going to need surgery. If his rehabilitation goes well, they said he could be back in 7 to 8 weeks. What would have to happen for him to be ready to return for the playoffs in that 7 to 8 weeks or so?
Okay, so ultimately, everything would have to heal, and then he'd have to be pain-free. That's going to be the key thing, because you have to be able to try to get out there, react, and protect yourself. So the Liz Frank injury is an injury to a specific joint in the foot, which is very difficult to heal and to run on. Luckily, he obviously did not injure that joint, but must have had fractures in the bones surrounding the joint, which once again portends more of a positive prognosis, because once the bone heals, then the joint is stable. And to answer your question, once it heals and he's pain-free, then he should be able to play. But that's the tricky part, being pain-free and able to react.
And let me ask you about that. When you say being pain-free, right, is that because if he's not, you're concerned about re-injury, or is that just because if he's not, you don't think he could really perform well enough?
Actually, both.
Okay.
So if he's not, then he's probably not going to perform well. And on top of that, if in fact he's not pain-free as he's running and doing things, then you place strain on other structures that you don't normally place that amount of strain on, which could lead to other injuries.
Matthew Stafford dealing with a spinal cord contusion. He'll be out the rest of the season, but I'm thinking this could end his career, right, Doctor?
Not necessarily. Not necessarily.
Right. Well, that's why I'm not a doctor.
So the key thing there is the other structures around the spinal cord. So, for instance, say if he had broken a vertebrae and he had, say, bone fragments affecting the spine or something like that, that's a different story. The contusion, once again, is, he got hit, he fell, and the cord got bruised, per se. But if all the structures are still intact, then once again it's just a matter of the bruise resolving. And as long as he doesn't have any neurologic impairment, which I don't think he does, I think they would have indicated that if that were the case, then no, he can come back from that in appropriate time.
Doctor, my finger, I got to bring this up. I my fingertip in softball the other day, it got hit by a softball, and I knew something was wrong. And I went yesterday to urgent care. Turns out I got an x-ray. It's broken. It's dislocated, apparently broken and fractured are the same thing. I'm actually I've got an appointment today with you all at Florida Orthopaedic Institute at about 10:45. But before I do that, should I just cut the tip off or just go see you guys and get further evaluation? Because I'm ready to cut it off. It's gnarly.
Well, the only person that I know that just had their finger cut off because of an injury was Ronnie Lott.
Yep,
with
that's right.
San Francisco 49ers. I don't think it's going to be that important to just have the finger taken off.
All right, so don't take it off.
No, don't take it off. That should heal. And obviously we'll evaluate you. We'll determine whether or not there's been any tendon injury as well. And as long as the tendons are intact, and it's just kind of a fracture to the bone, once again, in time, that should heal in place, and you should regain full function.
Golf 6 to 8 weeks. Will I be out on the course?
Never again.
Don't say that, Pat.
Well, I tell you know what? How good is your golf game?
I'm average.
Okay. Well, all right. Well, then we may get you back out there 6 to 8 weeks. Which finger is it?
It's my right hand, my dominant hand, middle fingers. I'm flicking everyone off.
All right, and it's the tip. You should be okay. You should be okay.
I love you, Doctor.
You should be able to grip the club okay in that regard. Now, look, but if you lose the strokes on your game, don't blame me.
Done deal.
Hey, Doc, really quickly before we let you go, to be 100% serious, we got a text here on the Bartow Ford DAE text line that says, I'm a 100% disabled veteran that is allowed to work. Without Florida Orthopaedic Institute, I'd be hurting a lot. I think that's maybe something people don't understand a lot, right? Is not only is this something where you may need the Florida Orthopaedic Institute and help for catastrophic immediate injury, but something that's long-term pain management, you guys can really help in that area as well, right?
Definitely. Oftentimes individuals have problems dealing with their spine and things of that nature, and sometimes things can't be corrected with surgery. But in those instances, then we can also help, with daily management from the standpoint of pain and things of that nature, so that we can, once again, keep you moving, keep you active, and get you back in the game.
Hey, Doc, really quick again before we let you go. Has anybody ever told you sound a little bit like Dave Chappelle?
I got to tell you, I haven't gotten that one. But that was the first time for everything.
Hey, the Pat and Aaron Show Injury Report is presented by Tampa General Hospital in partnership with Florida Orthopaedic Institute. They provide you access to one of the top orthopedic programs in the nation. You can schedule an appointment today at floridaortho.com. Again, Dr. Eddy Echols joining us for the first time. Doc, really appreciate your time today. Thanks for being with us.
Hey, thanks for having me.
Hey, great stuff. And go Navy.
Be Army, that's right.
Thank you, Doc.